Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and my wonderful wife will be joining us here shortly. We are super excited to have Dr. Alan Bauman on our show today. He's going to be discussing biohacking baldness. And I try to keep my head out of it so I don't see my so you don't see my baldness, but I'm going to be definitely tuning in today to learn about this. So, Alan, welcome to our show.
Hey, great to be with you, Shawn.
All right. So tell us a little bit about your background. Go all the way back, but in medicine and what you do now.
Sure. Well, I got started in medicine. If you ask my grandmother, when did I want to go to medical school, she probably would have said something like the day Alan was born. But through my years of growing up, I got mentored by a plastic surgeon who was a very, very close family friend and became a close mentor of mine and kind of guided me towards the more artistic and creative side of surgery. And as I went through medical school and then my internship and residency in general surgery, always thinking I was going into plastic surgery, I kind of found out about hair transplants on the side almost by accident. And this was in the mid 1990s when I guess most people thought hair transplants were pluggy and painful and all that. And I thought kind of the same thing. But I had met a patient who had had a recent hair transplant and he looked amazing. And it was totally undetectable. It looked great, which was shocking to me. And that kind of led me down the road of investigating hair transplant as a cosmetic procedure to help change people's lives that maybe I could add to my repertoire of other plastic surgery techniques and procedures that I was learning in my training. But I went down a rabbit hole after that, really the path less traveled. And, I ended up moving to Florida. And in 1997, I founded Bauman Medical Group. Bauman Medical Hair Transplant and Hair Loss Treatment Center has been located in Boca Raton, Florida for nearly 30 years. So 28 years. We also have a satellite office in New York. And I've had the blessing and privilege of treating over 30,000 patients here who are struggling with hair loss. So it's been a really fun ride. I've performed over 14,000 hair transplants, and it's an exciting field to be in. Obviously, very different than it was back in the early 1990s when I first learned about hair transplants.
So tell us what's different. Is it you talk about plugs, and now are you talking about follicular transplants?
Well, back in the old days, hair plugs really was the common term because that was the look of it. When people had a hair transplant, they had these large punch grafts that were harvested from the back of the scalp and they were implanted into the balding area, and it looked like doll's hair. Honestly, it didn't look that great, and it didn't look natural, even though it did grow. But over time, we got to more, let's just say, microscopic and progressed to a more minimally invasive style. So the whole field went from these punch grafts or plug type transplants to a linear harvest, which was basically a strip of scalp that was then dissected into small grafts for implantation. Till today, what we do is follicular unit extraction. And that's a technique whereby we're taking the individual hair follicles or follicular units literally one at a time from the back of the scalp and implanting them hopefully artistically into the thinning or the balding area. So there's a lot of nuance to today's procedures. It's a lot more microsurgical. It's a lot more delicate. It takes a lot more time and it takes a huge team to assist me with these procedures. But the end result is an undetectable and also painless process, actually.
So who is a candidate? Is it frontal baldness, scalp baldness? Who is the best candidate for it?
Well, if we're diving straight into hair transplant surgery and we're not talking about the preventative things, and I'm sure we'll circle back to all of that a little bit later on, when it comes time for hair transplant, basically you have an area where the follicles are dead and gone, and we're harvesting the permanent follicles from the sides and the back of the scalp to replace or to restore that density to achieve coverage. So for men, if they have a receding hairline, for example, usually that means it's too far gone to prevent with other medical therapies or to enhance with medical therapies. So we've got to use a bit of transplants to fix that. If you have a thinning or balding crown and you could literally see the scalp shining through, then usually you're going to need some degree of transplantation for that area. But if you decide to go down the road of hair transplant and you have not already started prevention to stop the progression of the hair loss, you're really on the wrong track. So it's important to really get on the preventative and the medical therapies first before you go down the road of transplants.
And let's talk about those. What are those?
Oh my gosh. Well, first of all, if you're starting to lose your hair, obviously the main thing is to look at the genetics. And of course, we can't change our genetics, but other things that can affect the genetic expression of male pattern and female pattern hair loss are lifestyle factors. So everything from our nutrition to our sleep-wake cycles, to our stress level, to inflammation in the body. All of these things can have an impact on your hair and even scalp health. So if your scalp is itchy or flaky or irritated, it could be not a good environment for good, healthy hair growth. So when someone comes to me and they're concerned about their hair loss situation, of course, we want to make the right diagnosis first. So there's a deep and detailed investigation into their history, both hair loss history genetically in their family, but also their lifestyle factors that might be impacting their hair growth situation. I mean, hair follicles are a very hormonal organ, as we say. And so, for example, male pattern baldness is triggered by one of the male hormones, DHT, dihydrotestosterone. So, one of the main things we try to do in men is to lower that DHT production in the body. And that can be done pharmaceutically. But certainly, there's a lot of other options besides what I just mentioned, pharmaceutical interventions like finasteride. There's also medications like minoxidil and laser light therapy. We can also use regenerative treatments like platelet rich plasma, stem cell therapy in the form of exosomes and things like that. So there's actually a wide range of treatments that are certainly available now that were not available years and years ago to help protect, enhance, and restore your own living and growing hair.
And so tell us about, I imagine it's kind of a progression possibly, or like with pharmaceutical treatment first, that's kind of the least invasive, and then maybe PRP or stem cell, or would you just go right into hair transplant?
Well, let's say you're just noticing the early signs of hair loss, and for men or for women, it could be a little bit of shedding, extra shedding in the shower drain or on your pillow and such, or you just notice that the overall volume of your hair is changing or texture is changing. That's a sign that you should get some kind of evaluation from a board certified hair restoration physician like myself. And one of the things that you would do when you first come in, before we start to talk about any kind of therapy or treatment, as I mentioned previously, is we want to get a good genetic history. We may do some DNA testing. We want to get some density measurements at the level of the scalp. And we've got some interesting ways to do that today. We have an AI powered microscope that looks at the back of the scalp where the hair follicle density should be pretty good. And we go around to different areas that are kind of bellwether zones where you would normally see some early thinning under the microscope, but maybe not noticeable yet to the naked eye to determine what's going on. So again, once we have a good solid diagnosis, we'll look at those genetic factors as well as the lifestyle factors, and maybe we make some adjustments. So, you know, for example, if you've got, let's say you're on a special diet, you're on a weight loss program right now, you're trying to get leaner, and it could be, maybe you're on a caloric restrictive diet, or you're on a fasting or intermittent fasting regimen, or maybe you're on a weight loss medication like a GLP-1 agonist, um, or you're a strict vegan or vegetarian. Maybe you have trouble getting enough protein in your diet. All of these factors could potentially impact how your scalp is making hair. Think of your hair follicles like little 3D printers, and their job is to make that long, skinny fiber, hair fiber. And if you don't provide it with enough ink, if you don't provide it with enough building blocks of protein for hair, you're not going to grow good hair. So it all starts with these, holistic approach first. So nutrition, diet, regulating stress, because cortisol is a killer for hair follicles as well. We want to know if you've been hospitalized, you've been under a traumatic situation. I just saw a patient literally about an hour or two ago, and about a month ago, he was in a very traumatic car accident, and it was an awful amount of shedding that occurred. And this is a gentleman who has had multiple transplants. He's been on medical therapy, and he had a hugely stressful, psychologically stressful, and physiologically stressful event that triggered a massive bout of hair shedding and loss of coverage. So, those are all some of the different things that we would start with. But yes, it's always the least invasive things first. So, it could be some nutritional modification, those lifestyle changes. We could use some non-pharmaceutical treatments like an at-home FDA cleared laser light device, a medical grade laser like the turbo laser cap or something. Younger patients often do great with PRP because their stem cells just rejuvenate really powerfully
Mhm.
from that kind of a therapy. But yeah, we're going to start with those things, or maybe progress to medications and pharmaceuticals after that before we do anything regarding hair transplants.
So when it comes to hair transplants, you take good follicles from wherever you find them. Usually, you're saying lower scalp in the back. Do those follicles eventually die too? So if you move them somewhere else, will those follicles eventually die also?
Well, the reason why hair transplants work and really are a long-lasting, relatively permanent way to fix male and female pattern baldness is because those follicles from the back and sides of the scalp, they are immune to those hormonal triggers of hair loss. So as we mentioned before, DHT, dihydrotestosterone, which is the hair follicle killer, enemy number one, that's what affects the hairline in men and causes the balding to start in the crown area, and it could progress. All of the scalp on the top could be lost. All of the hair on the top of the scalp could be lost due to DHT sensitivity. But if you notice, the end stage of male pattern baldness always leaves
Yeah.
this ring of hair around the sides and the back. And those follicles are immune, they're resistant, if you will, to the DHT hormone. So when we transplant them into the new location, let's say the hairline or the crown, they will live and grow there forever, and they won't be affected by male pattern hair loss. Now, there are some other factors, as we mentioned. Let's say you've had a hair transplant. God forbid you need, cancer therapy, or you're starving on a desert island. Of course, that's going to impair the hair growth on all of the different follicles in your scalp, regardless of their hormonal sensitivity. Um, so it's important to take that into consideration. Obviously, it's not just a hormonal problem, and especially in women, we know that their follicles are much more sensitive to those, whether it be nutritional changes or stress, and many other inflammation in the body. A lot of things can really affect female hair follicles a lot more in a more sensitive way than even men.
Janet, what comments do you have about female? You've probably seen that with females and hormone issues.
Oh, yeah. Too much, too little. Thyroid. See a lot of women with thyroid issues, having the hair fall out. Any thoughts on that?
Well, absolutely. I had mentioned before that the hair follicle is a very hormonally sensitive organ. And as you have probably noticed, if your thyroid is imbalanced, and that means too high or too low, or even if you're trying to replace thyroid, let's say pharmacologically, it's not the natural, levels of thyroid. You get kind of a spike when you take the medication, and then there's a drop over the course of the day. And I'm not so sure that follicles really like that either. So if you've
Mm,
had a thyroid imbalance, and you're on thyroid medication, unfortunately, both of those are risk factors for hair loss. So, if you can figure out what's dysregulating your thyroid and fix that, get to the root cause, as we say, that you have a better chance of helping your hair. But even in the presence of hormone imbalance, and I guess I should say also, today we see a lot of women who are doing hormone optimization therapy that might include testosterone, whether it be troches or creams or whatnot. Um, when you increase your level of testosterone from the outside, or you do just let's say a significant strength training regimen, you can boost up your testosterone as well. That testosterone will convert into DHT, and if you happen to be sensitive, you have that genetic
mm.
sensitivity, that could accelerate your natural progression of female pattern hair loss, or male pattern hair loss, obviously, as well.
Yeah, that makes total sense. Jen and I are, we specialize we're two pharmacists that specialize in hormones. So, we see this stuff quite often we'll get questions about how to have healthy hair. In fact, I just got one yesterday. What about supplements? Are there any supplements that you recommend for healthy hair?
Well, absolutely. So, we always say you are what you eat. And of course, supplements come in a couple of different categories in my mind. I think about nutrients and fuel. So we talked about protein. So like if you're deficient in protein, you got to boost up your whether it be lean red meat, or other sources of protein like fish, chicken, things like that, because you need the building blocks of hair. In terms of the supplement category, you can do collagen powder and such. That's helpful for skin and hair, and there's some good science behind
Mhm.
that today. B vitamins and biotin, of course, are kind of everybody kind of knows that that's important for hair regrowth. In terms of different, multivitamins and things like that, obviously, I've created my own special Bauman MD line of hair care products and nutritional supplementation specifically for hair. So if you're looking for those nutrients and fuel, obviously the Bauman MD line has many of those different things in there. But we also curate a lot of different products too. I mean, I'm a huge fan of Nutrafol. I was one of the first
Mhm.
physician prescribers of Nutrafol back over about 10 years ago when it first came on the market. And since then, we've got some other things such as Express A, which is I would call it hair candy, although it's sugar-free. It's like a gummy, if you don't want to take the capsules, like of Nutrafol, for example. And then there's the nutraceuticals, which are basically like the herbs that have a biologic effect, that don't fall into the categories of nutrients and fuel, but things like curcumin and turmeric, that would be an ingredient in Nutrafol and also in the Express A. You've got stress adaptogens like ashwagandha and other mushroom-derived adaptogens, which are good for stress. That was huge during the pandemic when we saw lockdowns with COVID and COVID vaccination and COVID infection problems with hair loss. So there's a lot of different things that you can kind of think about on the nutritional side before you step into, I would say, more of more medical grade laser light, low level laser, red light devices, and regenerative treatments.
Janet, what questions do you have, Dr. Bauman?
So we're big believers that people also need to get outside because I feel like there's something being lost. So what do you say to people about that? I'm a little bit fair skinned, so I have to be a little careful about my exposure and build it. But you mentioned light. So, but how do you see just the interaction with our environment helping people with their hair?
Mm. Well, I don't know if there's any specific data or research that has to do with, people who live outdoors having better hair or whatnot. I'm not familiar with any of that data. So if you come across any of that,
Yeah.
I would love to see it and hear it. But we do know that red light in particular has a very powerful effect on our cells' mitochondria. And this is information that we didn't have 20 years ago when we
Right.
first got laser light devices in the office. And certainly Andre Mester, who was trying to cause cancer on the backs of rats with a red light device, who was unsuccessful, by the way. He did not cause any cancer, but he did grow a lot of hair. That was back in the 1960s. He had no clue that it was the mitochondria that were absorbing those red wavelengths of light and turning it into the cellular fuel, turning it into ATP, the energy that the cells use. And today, of course, we know that red light on the scalp is helpful to decrease inflammation, to increase blood flow, and directly providing energy to the hair follicles that might be thinning. So, but the problem is, I don't know if you can necessarily go outside and get that red light.
Right.
You know, during sunset hours or whatever. Maybe you could, maybe you couldn't. But I would rather have a decent device at home where I know in 5 minutes, boom, I've got the treatment completed and done. And I guess, I've seen it all over the past 10 to 20 years of low level and red light therapy devices now on Amazon and all the Chinese knockoffs coming from the Far East. I would just say be careful out there. There's a lot of garbage, in the consumer realm and a lot of watered down devices. So if you're going to go with a red light device, get a Bauman Turbo laser cap. That's, the one that we designed with the inventor of the laser cap, Dr. Michael Rabin in Cleveland, Ohio, assembled in the United States. It was basically invented by Dr. Rabin and researched by the Center for Photomedicine attached with Harvard and Mass General with Dr. Hamblin and his optical physicist team, putting it all together to create the Bauman Turbo laser cap. And of course, we did the clinical trial work on that here at the clinic itself. So 5 minutes a night, and it packs flat for travel. It's a great device. So if you can't get outside during sunset, then maybe the turbo laser cap once a day would be the way to go.
Tell us about the clinical trial on the turbo laser.
Yeah. So what was very interesting is that when Dr. Michael Rabin was seeking the FDA clearance for his laser cap, and that's not just safety and that's not just a safety clearance, but also for the FDA at that time, it had to be an efficacy clearance. So we had to have some data. What we did was we had sham devices. So there were half head devices. We didn't know which side the patient had the laser, and we took photos, micrographic photos of the scalp in a variety of different zones, areas, according to his wishes. We used markings on the scalp with micropigmentation, basically like a medical grade tattoo, to go back to the same area again and again. And we compiled not only the hair check data, which was the cross-sectional bundle measurements, but also the hair density data. All of those photos, literally thousands and thousands of photos on all of those patients, hundreds of patients were sent over and evaluated by his team, blinded team. So it was pretty exciting to do that kind of work. I feel like, that's one of our little contributions to the field of low-level laser light therapy, and also to the field of hair restoration that Bauman Medical has done over the years. We have a lot of industry partners. Some of them want to do clinical trial work that's kind of quiet, and they just want to test and iterate some things. And then other folks want us to bring devices and products and treatments to market and make sure that we get good efficacy, that we have good before and after photos, with 100% transparency on how we do these things. So it's a pretty exciting part of the practice. We're always been kind of an early adopter over the years. And so people who want to enter into the industry usually come to us. Maybe not, if we're not first, we're definitely on the top list of those that bring stuff to the market. Now, a great example would be TED, transepidermal delivery of growth factors and peptides. We did that during the pandemic. I was one of the first clinical trial sites outside of the industry, outside of the research that was done in their manufacturing process. So that was pretty exciting to do that. And really the first 30 patients we did had amazing results. So it was very exciting to be on the front end of that technology.
So speaking of peptides, they're in the news a lot lately for about everything. So are there peptides for baldness?
Oh, absolutely. In fact, what I was just mentioning, transepidermal delivery uses ultrasound to make the skin more permeable. And during that treatment, which is in the office, no needles, no pain. We say no trauma, no drama. We're actually able to push peptides right through the skin. So copper tripeptide is a great one. Thymosin beta 4 derivatives, such as proherin B4, is a really nice peptide. But we also have topical peptides that patients can go home with, contain methylvalinate and PTB, DBM. Those are some of the good ones that I like to use. But the TED treatment is really nice. That's you can do that if you're, let's say, needle phobic or something and you don't want to do PRP, you come in for TED. It's one treatment per month for 4 months, and you're going to get about a 20 to 50% improvement in hair growth. Many times you'll see an improvement in pigmentation and hair quality as well at the same time. So it's a pretty exciting modality to brought to market here in South Florida. I was one of the first in the United States to have the TED. So great device. Can't get hurt with the TED. It's a really, really nice hair growth treatment. The really only downside is you've got to come to the office to get the treatment.
Yeah. So you must really enjoy doing what you do because you make people feel better about themselves.
Well, absolutely. One of the biggest blessings of being in the field of hair restoration is to see those folks with their lives changed on the back end. It's not as instantaneous as, let's say, Botox or a filler, that you can get in a plastic surgery clinic or a med spa. Hair growth takes time, but if you're patient, those before and after photos, they look different at 6 months and of course at 12 months after a hair transplant. And that's the payoff for me, helping so many patients really have their lives changed through the work that we do, and with my team as well here at Bauman Medical. I couldn't do it without my team, so I gotta give kudos to my amazing team here.
So how many team members do you have, including other physicians?
So yes, I have an associate physician, Dr. Rose. She's an amazing hair transplant surgeon. She specializes in African American and female pattern hair loss, as well as traditional male pattern hair loss and scalp health. I have a nurse practitioner, Trina, who's been with me for a number of years. She also helps out in the clinic, does most of our regenerative treatments. Also a great specialist for female hair loss and for early male pattern, female pattern. Now I have a certified trichologist, Kimberly Jenkins. She's incredible. They call her the scalp whisperer, and she runs my scalp clinic, and which is busy all day long. The funny thing is when I first opened the practice, I didn't even realize that about half of all patients are going to have some kind of a scalp health issue in conjunction with their hair loss situation at some point in their lives. So having the scalp health clinic has been great, not only for patients going through the healing process from a hair transplant, but dealing with all kinds of inflammation and stuff. But I do have over 30 team members now here in Boca Raton. And as I mentioned, the satellite office in New York, we're up there every month seeing patients and performing regenerative treatments there as well.
And so it's kind of obvious, I think, but I just always like our guests to discuss, what do you have a passion for?
Besides hair?
Yeah, right.
Yeah, well, I am an avid skier. I've been skiing since I was since I was in high school. So I train all year round so that I don't hurt myself on that one ski trip per year. With the guys, I've been going with the same group of guys for many, many years. We choose a different location each year, usually somewhere around my birthday. Falls out in March some point. But that's really one of my passions. But of course, health and wellness and longevity has really been a hobby of mine for many years. So I've been a member of the American Academy of Anti-Aging since 1998.
Mm.
I guess you could say I was a biohacker before there was that term, but
Yeah.
thank you, Dave Asprey, for inventing that term, because I feel like that kind of fits my attitude and modalities that I use for health and wellness. So I'm a big longevity fan. I love interviewing and talking to folks who are 100 years old and older, and finding out their secrets. Trying to see if they're lying to me or not.
Yeah.
But no, that's definitely a big part of the practice. We're very keen on, like I said, taking a holistic approach, because we're dealing with folks that want to improve, the length of time that they spend with their hair. And so, in longevity, we're trying to increase lifespan and health span. I'm sure you know those terminologies. And at Bauman Medical, we're trying to increase hair span. So that's really where biohacking baldness kind of comes into play. Using these different modalities like our lifestyle, our nutrition, our ability for meditation and relaxation, red light therapy, peptides, and so forth, to really enhance all aspects of our life. But obviously, because hair follicles are such a closely tied organ to our internal fitness and health, those things definitely improve your hair at the same time and help you preserve it.
So tell us, what's the most dramatic patient story that you can share with us that was the most remarkable for you?
Well, I guess there are a couple of patients that do come to mind. Of course, there's that first patient that I ever met, and I didn't operate on him, obviously, but he's the one that kind of gave me the spark, if you will, to go and chase down this idea of hair transplant surgery. And I mentioned him briefly earlier in our conversation. When I first met him, he was very excited that I could not tell that he had had a hair transplant. And basically, I made him explain to me, what he went through and how it happened, because I was
Mhm.
so curious about it. And one of the things I remember most about that conversation is not just him explaining the technique and the technology, which sounded really awesome and artistic and all of that, and how he found the doctor that he went to and flew to his clinic and so forth, but also how his life was changed from that procedure. So I couldn't take credit for that procedure, but it was one of the ones that
Yeah.
sticks out in my mind, because he told me that his life was totally different after he had had the hair transplant, both socially and professionally. He showed me pictures of his wife and his kids, and he was the board of director, and so all these different things were happening. Became the CEO of this company and so forth. So really, his entire life changed, and he attributed it to his hair. So that kind of led me down the road that there was something powerful going on with hair restoration that maybe I should pay attention to. Um, but in my own practice, I had the opportunity to work on my father. My dad wore a hairpiece for 20 years. He was almost completely bald by the time he was in his mid 30s. And
Um,
about 20 years later, I had the chance to do a large session of transplants. Actually, we did multiple sessions to help him restore his full head of hair. He's a dentist. My parents still live in Jersey, and they overshare on Facebook and still travel internationally. But you'll see he's 84 years young and living life, and today with a full head of hair still from
yeah,
his hair
right.
transplants.
That's cool.
So
That's really cool. All right.
he's a good guy, but probably one of the more powerful ones that really sticks out in my mind, aside from some of the pro bono work that we've done for kids who have had like birth defects and or injuries or trauma patients, are really some of the work that we do with the veterans. And I've met a military veteran from here, who actually was in a helicopter accident in the in the in the mil in the combat theater, if you will, and he had a burn across his entire scalp. And we had the opportunity to transplant all the hair follicles from the sides and the back of his scalp, which were unscathed,
Mm.
into the scar tissue area. And we used
Wow.
all those modalities that we just talked about to restore literally a full head of hair for him. So I do have a soft spot in my heart for these military veterans. And I'm not sure if you know, but one of my other passions is to help prevent PTSD related suicide in our active and retired military. And so that's one of the things I do kind of on the side as a volunteer medical director for Gray Team. So, but that's, those kinds of things, those kinds of restorations are really kind of exciting for me to do. Because, those guys who are in the military have given up so much to help protect our freedoms. It's like the least we could do is to help them in any way, shape, or form. Whether it's to create that social network that helps their lifestyle, get them back on nutrition and fitness regimen to improve their situation, deal with the PTSD or traumatic brain injury that they're dealing with. But obviously, my skills as a hair restoration physician, if they have some injury or trauma to the scalp, to be able to give it back in that way is really one of the more fun things to do in the practice.
That's a great story. Thank you for sharing that. And thank you for being on our show today, Dr. Bauman. You've really helped us realize our goal, which is to educate and empower individuals to take charge of their own health. So I really appreciate it.
Well, Shawn and Janet, really, it's been great to be with you. If you get any questions from your listeners regarding anything that we talked about today, I'm happy to come back and answer those questions for them. Obviously, we've got a pretty robust website. So if they've got, some questions about hair loss, they don't know where to start their journey, BaumanMedical.com is the place to go. There you are. You got the Biohacking Baldness up there. It's been one of our themes for a number of different years. You can interact with the website. There's literally thousands of pages of information on all the different technologies that we use and diagnostic tools and ways to help preserve and enhance your hair. You can even just ask a question. Go to BaumanMedical.com/ask and just type in any kind of question. Make sure you put in a way to get back to you so I can get my answer back to you. But of course, many of our patients do start their hair restoration journey from the website by clicking schedule a consultation. And whether from your home or phone, I'm here to help answer your questions or get your hair back or keep the hair that you have. That's what we're up to.
Thank you so much for being on today.
Hey, great to be with you guys. Look
All right,
forward to
thank
doing it
you.
again with you soon.
Yep. And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Thursday to our midweek podcast, 8 a.m. to 9 a.m. Pacific Standard Time. Thank you.